Welcome back to my animal education series. Today I'm at the Johnson College Veterinary Science Center with Kimberly and Jolyn. Hello.
Hi.
So, where are we right now?
Well, currently you're sitting in the Johnson College Veterinary Science Center, and it is our home base for the veterinary technology program here at Johnson.
So, what do you guys do to help those students here at this college?
Well, what we're preparing these students to do is to obtain their associate's degree in veterinary technology and then to go on and sit for what is known as their national board exam. After they take the exam and hopefully pass the exam, they will become certified veterinary technicians in the state of. We would like to parallel our job once we're out into the world and licensed with that in the human field. We are similar to a licensed physician's assistant.
So, about how long will it take, through college to get to passing and going off into the real world?
Some students actually do a 3-year program, but we typically do a 2-year degree. So after their 2 years and they take the VT&E test, they can be in regular practice.
So, this is kind of a clinic area for animals. So, what animals do you usually work with?
Typically here we see dogs and cats for any procedures, dentals, spays, neuters. Yesterday we actually saw a skunk just to see her incision to make sure it wasn't dehiscing or have any infection, but typically we do see dogs and cats here.
What is the most bizarre animal you have seen here?
Well, we've had in the past, besides the skunk that we had yesterday, we have had snakes in the past, pet snakes.
So, is that more of a challenge to work with since you normally work with dogs and cats?
I don't know that it's more of a challenge. It just sometimes takes us a little bit out of our comfort zone of what we're used to working with. That snake in particular had to have radiographs done for a potential foreign body, which means he ate something that he should not have.
Do you guys help dogs and cats with rabies shots and other vaccinations?
We do. We do various different vaccinations against bordetella, distemper, which includes the parvovirus, leptospirosis, and rabies.
And what kind of animals will the students work with here while they're in the program?
Okay, during their 2-year track here, in their first semester, they're exposed to our colony, which is rats, rabbits, and mice. What we're doing with those animals is not research. We're not spraying hairspray in their faces or anything like that. What they're learning is husbandry, so how to take care of these animals. They're learning how to medicate these animals if necessary. They're learning how to restrain, and they're also learning basic nutrition needs of the animals. In a second semester, they'll be exposed to large animal medicine. So we have agreements with a couple area equine farms. So they'll go out and get some basics on equine husbandry, how to medicate the horses, how to do basic bandaging of horses' legs and tails, and again, basic nutritional needs. And we have the same thing for bovine. We have an agreement with a past student, and so we go out to her dairy cattle farm, and they get exposed to the same things for the dairy cattle.
So should we go?
Sure.
Parts of the facility?
Sure, absolutely.
So what room are we in now?
This is the feline room. We have the smaller scale over there for the cats. So when the owners bring in their animals, this is where the cats would come in for the doctor to perform their physical exams.
So what kind of procedures would you do in this room?
Not really any procedures per se in this room. What we would do is the physical examination. We would ask a series of questions to the owners. You know, why is Fluffy here today? What's going on with him? A history of what's been going on the last few days. Do they need vaccines? Potentially any diagnostics that would be performed. We would ask the owners to take the animals into the treatment area where we would perform blood draws or ear cytologies and things like that.
So what is the most common thing that you usually get with the felines here?
Felines, usually we get animals that need their vaccinations. So their rabies or their feline FVRCP it's called. Also animals that need blood work to see if they are leukemia positive or negative, just to make sure that they don't spread the disease into the public.
So that's pretty good information about this room, so should we move on?
Sure, come on.
So what room are we in now?
This is the radiology room.
So what kind of things would you do in this room?
This room, we would actually take radiographs of patients to diagnose what's going on with them. So if a patient has been vomiting or having diarrhea for several days, we could potentially take abdominal radiographs to see if they ingested a foreign body, which would be causing a blockage in their intestines. Also over here, we have our digital dental radiology. With this machine, we can actually take radiographs of the arcades of their mouths, and what comes through the x-ray beam will be automatically brought into our system in the computer, so you can see exactly what is going on with the mouth within seconds instead of having to actually process the film.
So before we start recording, you were explaining to us about scatter radiation. So how do you kind of protect yourselves from that?
Good question. So what I'm wearing right now is called PPE, or Personal Protective Equipment. Requirements for taking radiographs are this lead apron, my dosimetry badge, which measures the amount of radiation that I'm getting, and a thyroid shield, and lead gloves. Okay? Scatter radiation, as long as we are in our personal PPE, have the door closed, which is also lead proof, we should be safe to take radiographs without getting overexposure.
I imagine with animals, it's very hard to kind of keep them in one place for more than 5 seconds.
It is.
So how would you keep them in one location?
We have various amounts of restraint involved. So number one, we can use chemical restraint, so a sedative or a tranquilizer to keep them calm while we take the radiograph. You know, if a patient is very stressed out, we don't want to stress them out more by holding them down and detaining them, so we'll give them a little bit of a relaxer to take their mind off of it. We also have these troughs. So if a patient needs to be on their back for an x-ray, we can put them in this nicely padded trough and hold their legs up. So in that case, they have a comfortable padded area for them to be on their backs. We also have over here what are called sandbags. Now, they're not too heavy,
No.
but for a small cat, they may restrain them. Okay, so if this is your cat, you can put this sandbag over their abdomen and kind of keep them still.
Well, thank you for telling us about this room, so should
You're
we move
welcome.
on?
Absolutely.
So what room are we in now?
Right now, we're in the treatment room, and this is the area where our patients will be prepped for surgery. They'll be anesthetized and put on this table. They'll be intubated, and what intubated means is a tube will go down into their trachea, which leads to their lungs to help them breathe. Exactly the same thing that happens when a human goes under anesthesia. They're hooked up to an anesthesia machine, which is providing them with what is known as an anesthetic gas, and it's going to keep them in a stage of anesthesia so that we can safely perform a surgical procedure. They'll also have pre-admission testing done prior to their surgical procedure, which is where we'll run the full gamut of blood work, which includes a CBC, which is a complete blood count. So we're looking at their red blood cells and their white blood cells and how they're functioning. We'll also do a 14-panel chemistry panel. The chemistry panel is assessing organ function to make sure that their organs are functioning properly before they go under anesthesia. And over here again on the counter, we have our multiple CBC machines and our chemistry machines as well. So also in this room, our appointments will have their basics done in this room. We don't like to perform any sort of procedures or even administer vaccines in front of an owner. Sometimes the owners get a little upset, which gets the patient a little upset. So if an owner is bringing their pet in simply for vaccines, maybe a physical exam or some basic blood work, we bring them back into this treatment area and perform all of those tests back here, and then we'll return them to the exam room to the owner. So this room is kind of the most exciting room for our students here during their 2-year stay here. This is our surgical suite, so this is where all of our surgical procedures take place. Again, we have another anesthesia machine, just like the one that was in the treatment room. Basically the same as an anesthesia machine would be in a human operating room. Next to the anesthesia room, we have our fluid pump because all of our patients are put on IV fluids while they're under anesthesia. So that they're not laying on a cold stainless steel table, our patients are put on a warm air circulating pad, warm water circulating pad, so that keeps them warm during surgery. We're also monitoring their body temperature throughout the procedure to make sure they're maintaining their normal body temperature. This last machine here is actually known as a monitor. It's a 6-point monitoring system that we use. It actually does take the patient's blood pressure. We have blood pressure cuffs here that get placed on the patient. It monitors their heart rate, their pulse rate, the oxygen saturation rate, which we want oxygen going through, being carried by the blood through our body. So it's also checking, it does an ECG lead, which is just like an EKG on a person where you're seeing the heart rate across that graph paper. And it's also monitoring respirations.
What is this kind of?
Yeah,
little
lone box
here?
by itself. So this here is our Doppler for also measuring blood pressures. So what we can do with this machine is if we're having trouble getting a valid blood pressure by using these blood pressure cuffs, we can do a Doppler blood pressure. So what we do in this case is we'll actually shave an area on the patient where their pulse is strong. Generally happens to be what you would know as their wrist. So we'll shave that area, we'll put on a little of our ultrasonic gel, and we'll put the probe right on that area, and through the speaker we'll be able to hear the heart rate.
On the way in, I saw this kind of thing you'll see at the dentist office.
Yes, it absolutely is the same kind of thing you'll see at the dentist office. This is what we utilize for our dental prophylaxis. Our patients should be getting, actually our pets should be getting dentals done when needed. A lot of owners don't realize that patients do need dentals, and yearly cleaning is generally encouraged, especially over the age of 3. But again, that's going to vary based on the pet.
Well, thank you so much for telling us all about this facility here.
You're very welcome.
And if you guys enjoyed this week's episode, don't forget to leave a big thumbs up down below, subscribe to my channel, and also check out my Instagram @ColeShirk. And as always, I'll see you next week.